Good afternoon, everybody. My name is Thersilla Oberbarnscheidt. I'm welcoming you here from Pittsburgh. I'm an assistant professor of psychiatry with the university and work as an addiction psychiatrist in an outpatient clinic for the university and for UPMC. And I'm going to be talking about delta THCs. I have no financial disclosures to share with you. As you can see from this slide, there's a lot of various products available with the name delta THC, and it is frankly confusing even for people who work in the field of substance use. There are so many different available formulations of these products, and you might learn from your patients about them. There are edibles, gummies, cookies, brownies. You can smoke them. Vaping is very, very popular nowadays. You can use delta THCs as lotions, ointments, or even as rectal depositories. The current trend of delta use is that the delta 9 THC is from the original marijuana, so it's therefore directly from the plant. And the current delta 9 THC or THC products that we have on the market is not what the THC used to be. The concentrations and potencies have drastically increased over the last decades. And we know that the delta 9 that the THC concentration is responsible for the psychotropic effect and for the euphoria that patients experience. The higher the THC content is, the greater is also the risk to develop a toxic effect, or also to develop an addiction. It's hard to miss the current trend here in the US and the public popularity of delta 9 THCs and the ongoing legalizations throughout the country. So the delta 8 THC, on the other hand, is also, it's a fast-growing segment under the hemp products. And it's a little bit more tricky to track the actual quantity of users. So most surveys or studies that look at trends of use go towards like Google searches, for example. And we see here that the recent Google searches for delta 8 THC have increased by 850% in the years of 2020 to 2021. So, and we also see that there's an overlap. So delta 8 THC is particularly popular in states where actual marijuana is still illegal. But even in states where it is legal, researchers have found that about 23% of users are also using the delta 8. And in general, it's about 35% of users that use both the marijuana and the delta 8 THC. And that is frankly a new and big market. And when we look at this last point here, search and popularity in the last 2 years created over $2 billion in sales. So a little bit of the legal background, because there's a lot in the press, even in regular newspapers right now. I just saw an article in the New York Times, and there was one in the Washington Post. So delta 9 THC, as it is derived directly from marijuana as a plant, or the cannabis sativa, it is a federally Schedule I substance. So it's an illicit substance. However, on a federal level, this 2018 Farm Bill created a loophole, so to say, for hemp-derived products. So these delta 8s that are derived from hemp, if they supposedly have a concentration of less than 0.3%, they are no longer scheduled and no longer illegal. So that's what makes them accessible. So some states started to disagree with this federal legalization of these hemp products. And we're seeing here that some states, and those are the ones in red on the map, started to really restrict or completely ban Delta-8 products. The states in yellow have concentration restrictions or also quantity restrictions. But this is also an ongoing process, and just recently increasing states are, banning the substance. Overall, delta THCs, and that's a big problem, are easily accessible. They are sold in convenience stores and gas stations. You can buy them online. There's no established age minimum to buy these products. These products don't contain any warning labels. They don't contain actual concentrations. There's no dosing guidelines, no follow-up, and most of them also don't undergo any kind of laboratory testing. So if we compare the different pharmacologies of these products, Delta-8 and Delta-9, also Delta-10, they're related. So the main difference is their molecular structure and the location of the double bond between the carbon atoms. And so depending on the position where this is, they are either 8, 9, or 10. And Delta-8 THC is naturally found in cannabis as well, but in much, much lower concentrations. So mostly to synthesize or produce delta THC for the market, companies or manufacturers must first extract CBD from the hemp and then convert it into psychotropic cannabinoids through a series of chemical reactions. And there's no standardized process established how to do it. And there's no certification process how companies actually, produce these. So the danger with that is that oftentimes common household products or other toxic substances are byproducts in the actual Delta-8 THC products. So, and those can include also heavy metals, for example, lead, solvents like acetone. And when these toxic substances get inhaled by the user, they bear a major, health concern as well. So frankly, these Delta-8 THCs often are also not produced in a clean or sanitary settings or in a real laboratory. So a lot of unregulated processes. So when I started this talk, I wanted to talk a lot about the Delta-10 THC too, and that's why I included it in the title. However, it's such a poorly researched substance that there is really not much available yet in the literature. So Delta-10 THC was actually produced by accident. So a company in California called Fusion Farms, they ordered marijuana and they wanted to produce a biomass. But then what they didn't know was that the product that they had purchased was treated with a fire retardant to protect the marijuana from the California wildfires. So they started with their usual process and then discovered this new formulation, and that was Delta-10 THC. So since then, though, Delta-10 THC is also increasing popularity and rising numbers of sales are on the market. And it just has that new novelty factor too, that people get interested in trying this new substance. And it's supposed to work a little differently than the Delta 8 or 9. It's supposed to be more activating, help with concentration, creativity, and energy. And to less paranoia is reported with that substance. So I think we will hear more about it as time goes and as the more case reports also become available. Tricky with this substance is too that it's not showing up in regular drug screens. So if we see somebody in the emergency room setting, that might be a little bit trickier to diagnose. So in general, how do these delta THCs work? They work on the cannabinoid receptors. So we have two main receptors. One is centrally located in the brain. That's the CB1 receptor. And supposedly the Delta 9 THC works more on the CB1, while the Delta 8 is supposedly more working on the CB2. So that's why they say it has a less psychotropic effect. They both activate the endocannabinoid system. That's the one responsible for the euphoria for the high. Deltas in general are very lipophilic, meaning they cross the brain barrier rather easily and have a quick onset of symptoms and of euphoria. They do stay in the system quite long and get stored in lipoid tissue and then redistributed. So those are common conditions why people would choose to use delta THCs. Similar list to what people would use marijuana as a substance for. You see here too a lot of devastating conditions. Psychiatrically, the main triggers to use are relaxation. Surveys say around 70% of users try to achieve that effect, but also euphoria or pain relief are predominant. With this desired effect, there is a lot of toxic effects that we see with the Delta 8 and the Delta 9 THC. It's more intense with the 9, but cognitive distortion, sedation, tachycardia, paranoia is a predominant symptom that we see when patients come with intoxication to the psychiatric emergency room and are psychotic and act erratically. And then anticholinergic symptoms, but also respiratory symptoms. When they smoke it can trigger or cause COPD as much as the tobacco use can. That's another symptom. So cannabis hyperemesis syndrome is something I wanted to mention for the completeness for the clinicians here. We know that it is associated with cannabis use, but it can also occur with the Delta 8 and Delta 10 use. Patients will present with cyclic vomiting, very difficult to treat. And one of the treatments, actually, what I put on the bottom here is hot showers. So that's something that might help also make the diagnosis when patients present, when they say, oh, I was at home. Yes, I smoke and I have been smoking, but then I took a shower and these gastrointestinal symptoms improved, actually. There's no direct antidote or treatment for this condition, mostly providing motivational interviewing, try to get them to stop and into treatment and otherwise symptomatic treatment. All right, I'm going here over some differences from the Delta 8 and Delta 9. So Delta 8 is also called diet weed or Delta light or light marijuana. So overall, people say the effects are less potent, less severe, and that's why you also have less toxicity. For some people, it's attractive because it's usually a little bit cheaper than the Delta-9 THC. Main difference, too, is for Delta-9 THC, we have two FDA-approved medications also on the market, the dronabinol and nabilone, with the indications for chemotherapy-induced nausea and vomiting, and also for AIDS cachexia. For the Delta-8 THC, there's no approved medical indications by the FDA. So oftentimes now when we have patients in the emergency room or in the hospital that present with Delta-8 or 9 intoxications, the main guide to make the diagnosis is to get a thorough history and timeline of recent event, hopefully some collateral information. Again, with toxicology screens, Delta-8 THC or 10 are oftentimes not showing up in that regular drug screen and the immunoassay. So specialized tests must be ordered that might not be available in every hospital. Mostly the effects are dose dependent. So the more they ingest over a short period of time, the more severe the toxic effects. In terms of clinical management, it would not matter if it's a Delta-8 or 9 intoxication. We would provide symptomatic treatment, and if they're really agitated and paranoid, to provide a more quiet, calm place to calm down. There's no antidote available for either substance. So now I wanted to go over a couple of problems with the Delta-8 mainly. And that's, as I said, it's not regulated. There's no real federal supervision. There are now some studies coming forward looking at what are people really getting when they purchase these substances. And that's quite eye-opening. So LeapReport.com, they looked at CBD products and Delta-8 and 9 products, and they saw that here a lot of the 38 products that they tested had illegal levels of the Delta-9 THC, so more than the 0.3%. That makes that product legal under that farm bill. 32% only had the advertised amount of the Delta-8, and the rest were off 10 to 102%. So big discrepancy there. There are reports from Michigan where law enforcement agencies have seized Delta-8 products that were falsely labeled as CBD products. And also this study here on the bottom has noticed these discrepancies of what's labeled on the product and what it actually contains. Same with a group here from Maryland looked at Delta THC products and noticed 60% didn't have any warning statements. There are no expiration dates or any kind of certificates for these products. And they also criticized that there's really no standard dose available or recommended for Delta-8 THC. Also with online sales, this is also really interesting. This study looked at 110 unique hyperlinks and over 7,000 tweets for Delta THC sales, and then found age verification was not found in over half of the websites. 60% did not report a physical address. 65 sold, or 45% sold their out products directly to the consumer. Also, 90% of the detectives vendors shipped Delta-8 products to addresses in states where the sale was prohibited. So There's just, with this lack of regulation, a lot of illicit activity happening in the US. And particularly vulnerable are the adolescents, simply because of the colorful product, the cartoon-like images, and frankly, also lack of education of these substances and what they can actually do. Oftentimes, Delta 8 THC is sold in the same store of CBD products or kratom. So there's a low threshold, since they're so available and easily available, to actually purchase them. However, calls to poison control centers have really increased. And if we look at the numbers here, January 1st, 2021 to February 28, 2022, they got called of about 2,362 cases, and unfortunately, even one, sorry about that, even one pediatric death. So most common symptoms for the overdoses would be respiratory depression, hypotension, or severe sedation. There is a big economic impact too. We are seeing a shift from the CBD products over the THC products. So as far as we can track sales right now of these products, we see they are very popular and sales are increasing.
Sorry, Thersilla. How far are you?
I have, I think, 3 more slides. I'm finishing up. I can make it quick. Sorry about that. Just for the physicians here, this is a chart of drug-drug interactions with other substances. So as we see, it's really those deltas interact with many other medications that we provide. I wanted to mention that there is a risk of addiction, as we know from cannabis. It's not established for the delta drugs yet, but something to watch out for. And I wanted to mention that the FDA also took action and had sent out warning letters regarding these delta THC products and pointed out that there's no approved medical indication for their use. So I think we have to do some changes moving forward. There is a new Farm Bill coming out this year, and maybe some of these points that I'm listing here on the slides will be addressed, and we'll have more regulation moving forward. Sorry to go over time, and thank you for your attention.